Greetings, it's Dr. Schiller. So, thanks for coming in. The topic today is what kind of exercise, and I would also add physical treatments, are safe and effective for people with fibromyalgia and chronic pain. And it's a really important question because, if you think about the mainstream recommendations for fibromyalgia and also chronic pain, conventional point of view doesn't really have so much to offer, right? Like it used to be that we would had clear evidence, or we thought that like Lyrica and Cymbalta have significant positive benefits. That's kind of fallen down in light of more recent data. And a lot of docs don't even recommend those things anymore because of the potential side effects and the fact that the overall benefits in the research don't seem to be so great. My own experience is that some people really benefit from those drugs, and like anything else in research, I just think it's important to know that when you have a clinical trial that says this intervention works, or it says this intervention doesn't work, it's typically not a blanket statement, right? Like conventional medical research is based on the assumption that if we look at a population and we compare two groups and we find that on average the people who got the intervention either were helped or not helped, and there's a significant difference between those groups, then we can say the intervention is either useful or not useful. But that doesn't apply to individuals. It really doesn't. And, in any positive study where they did get a benefit, well, there are people who didn't get benefit and people who had side effects and couldn't tolerate the drug. And in most research where some commonly used intervention was tried and failed, and they failed to show a significant difference in outcome, there are frequently people who did get good benefits and outcomes. And, research is meant to distinguish what are the effects of the actual therapy versus placebo. But what we know is that especially in complex systems like fibromyalgia, where there's so many different variables, that you're not really controlling all the variables. And it's not so simple as like, oh, well, if it's shown statistical significance, then it works. And if it's not, then it doesn't work. And if it does work, it must be just placebo effect. Like, it's not really logical and it's not really scientific to think that way. So my view is that what clinical trials do is they give us a starting point for saying, here's something that makes sense because we were able to show clinical significance and statistical significance, that more people got better from it than didn't. Okay, so that's our starting point. And then the background is that there are individual variability and individual differences. And the bottom line is that for you, when you're thinking about what to use, what works for you is what works. And what doesn't give you side effects is what doesn't give you side effects. And it's like you need to become a critical thinker who can carefully choose what to try and then carefully proceed and see how it helps you or doesn't help you. See if it causes you negative effects or doesn't cause you negative effects. And I'm here to try to guide the process, but ultimately you are the one in the driver's seat and your healing path begins with you. And I just really want to strengthen, empower, encourage you to learn the qualities that are inner qualities that you need so that you can think and make choices, to get support to make choices, to get support to proceed so that you actually believe in yourself and your ability to heal, and that you keep working to find what works for you and discard what doesn't work for you. Keep a journal and keep track of what helps and what doesn't help. Write it down because in a year or 2 years you might forget. Somebody might ask you. You might show up in my office and I'll be like, well, what did you try that time when you felt better? And you might be like, oh, that happens a lot. And some of my patients are able to say, oh yeah, well I got notes right here. We tried this dose of this supplement and this dose of that supplement. I'm like, oh, okay, well I think that's too high of a dose. Or that's not a high enough of a dose. Or whatever it is. So keeping track, keeping organized notes, keeping a journal, all good stuff to help you make decisions as you go down this healing path. All right, let's get to the topic at hand. Exercise, physical modalities. Let's focus on fibro because the issues are so complex and rich and important. The big issue is the low threshold. And the low threshold means if you do too much, you're going to go over the threshold of what your body can tolerate. We know that fibromyalgia has a bunch of complex biological imbalances, and one of them seems to be impaired cellular energy production and exquisitely sensitive pain processing. So there's this sort of cycle that gets started if you go over your threshold. What do I mean by threshold? Everybody's got a threshold of how much work they can do without like hurting themselves. I could run a couple of miles, but if I ran a marathon, I'd probably be wiped out for days. And somebody with fibromyalgia maybe could clean one room in the house, but if they try to clean the whole house or walk a kilometer or half a mile, they might be wiped out because the cellular energy production is impaired. There's changes in cellular function. Inflammation, oxidative stress, mitochondrial function, hormonal changes, shifts in the autonomic stress response, all of those are interacting with each other. When you get up to that threshold where you're overtaxing the biology, there's a whole cascade of things that happen that it can include the mitochondria starting to get even more dysfunctional and producing what we call a reactive oxygen species or free radicals that stimulate inflammation, that stimulates more mitochondrial dysfunction, and overactive stress response that feeds into that. The immune response kicks in, the hormones kick in, all these shifts that happen, and that's called a fibro flare. And that means like, oh my gosh, I'm wiped out, I cleaned the house and I can't do anything for 3 days. Have you ever experienced that? So that's from that cascade of things that happen when you go over your threshold. So the first thing is understanding a little bit in your case of what your threshold is. And you can't find that except by trial and error. You can learn how much you can do without overdoing it. And what you can do is come close to that level and continue to stay active within that level. This applies to any kind of exercise that you do, any kind of physical modality that you do. So you want to expand your envelope, but stay inside your threshold, so that you can actually teach your body to improve its ability to generate energy and to do physical work and actually build your endurance. And most people can do that if you stay inside your threshold. And now if you get into some of the other interventions that are more on the biochemical metabolic end of things, whether it's rehabbing your hormones or your immune system, your gut, or dealing with infections or mitochondrial nutrients or all sorts of different things that people do on a metabolic biochemical level, you might be able to increase your threshold. If you reduce your inflammation, if you modulate your sympathetic parasympathetic balance so that you actually boost your relaxation response. These are all things that can potentially increase your threshold so you can increase, and you build it from there. Just like any athlete, I was a trained athlete when I was a kid, and we would come back to say fall swimming season and we'd start training. And the coach would be like, you guys are out of shape. You've been at the beach all summer. You've been playing soccer. You haven't been swimming. And we'd start training and it would hurt. We'd do so many 1,000 yards. We'd be wiped out. We'd do that every day. After a few weeks, that was just our new threshold. We could do it. Your ability to build your threshold when you have fibro is decreased, but you can still build it. And so doing the biochemical and metabolic stuff, improving your sleep, improving your autonomic balance, and the exercises that you can do to build your threshold, very important. Okay, so let's talk about kinds of exercise. Classic exercise that most people think about are like gym exercise. You get on the aerobics, you do the stepper, you do the bicycle, you walk, you do the treadmill, and then there's resistance exercise, which is like weights or therabands or Pilates or other exercises where you're working against resistance. And those are two different classes. They're both potentially valuable and important, and they're both potentially very irritating if you have a heightened sensory system and if you have a low threshold. And you have to discover that for yourself. A lot of my patients with fibro are able to walk briskly. Some of them are able to ride a bicycle. Some of them are able to swim. Some of them can completely wiped out. And of course, that's true for people with chronic fatigue syndrome and post-exercise muscle soreness and all of that. And so you really got to find what works for you and what doesn't work for you. Strength training can be incredibly valuable because it causes your muscles to release a whole set of chemistry and chemicals and substances that are like, they're hormones, they're communication molecules. They are telling a story of joy and pleasure and good and positivity to your brain and your immune system and everything. They reduce and balance your immune system. They can balance out your sympathetic parasympathetic system, but only if it's within your threshold and you can do it. So that's why the recommendations are try to do aerobic exercise, try to do resistance exercise. But that's also why people get referred to physical therapy, and the physical therapist isn't trained to work with people with fibro. Maybe they don't understand so well how to find the threshold and help a person stay within their threshold. Maybe they don't understand so well that like working out to pain, to a point of pain, isn't always a good idea because it can really trigger a pain flare. So a lot of people who have had these horrible experiences where, you know, they overdid it because they were in hands of a trainer or a therapist who didn't understand the problem. And so if you're going to try to do physical therapy, you know, like gym type exercises, aerobic and resistance training, what I strongly encourage you to do is search out somebody who can really guide you, who's worked with people with fibromyalgia and chronic pain. I hope that makes sense. You know, so it's like it's doable, but you need the skill and the expertise and guidance to do it in a way that actually helps you and doesn't harm you. Okay, so that's sort of the classic gym type, physical therapy type exercise. Really important stuff. Now we'll get to one of my favorite topics, which is what you might call mindful movement. And there's a bunch of different mindful movements. Mindful movement is kind of like meditative exercise, right? And it tends to be more whole body exercise, but let me get into that. You can go to the gym, you know, and like you go in the gym and they're playing music. And maybe you're talking, maybe you're watching a television show, or you're watching the news while you're doing the treadmill. You're not paying attention to your body. Your body is, you know, you're like here and your head up and you're in your head and you're talking, you're thinking, you're out there, you're running with your friend, you're schmoozing, you're talking, you're looking around. You're not in your body. What do I mean by in the body? What I mean is that you have a three-dimensional map of your body that maps into your spinal cord and your brain. And all of that is plugged into your sensory apparatus, your ability to perceive consciously. It's plugged into your emotions. It's plugged into your sympathetic nervous system. Everything that you've experienced in your body, whether for good or for bad, for pleasure or for pain, for joy and triumph versus trauma, all of that is registered into this integrated system that includes this map of your body. And most of us don't get trained to pay attention to the body. And what I'm suggesting to you is that learning to pay attention to your body in a non-judgmental, compassionate way is incredibly powerful on its own. Just simply attentional exercises, body scan exercises, bringing your breathing or your sense of breathing into your body, incredibly important. I train people in these techniques and it makes a huge impact on pain, on a sense of well-being. It's part of what we do in Movement Towards Health and other contexts. Really powerful. The next level of that is bringing that awareness and that presence into movement. And if you go to a well-taught yoga class, and if you go to a well-taught Tai Chi or Qigong class, and Pilates sometimes, and Feldenkrais awareness through movements, and then there are other sort of like, you know, boutique type movement systems that people have created and come up with that, you know, they put their name on it or whatever. The common theme is, you know, that's what Movement Towards Health is, right? Like I created this thing and I gave it a name and I'm teaching it to people. But what is it? Well, you know, I've practiced all these other things and learned a lot of different things from Tai Chi, from yoga, from practicing osteopathy and putting my hands on people's bodies and sensing all the stuff that's going on in there, from doing a lot of deep meditative practice on my own. and synthesized a set of practices. Okay, great, there's a lot of different approaches like that. But there's this common theme of teaching you to pay attention while you're moving. And when you bring a calm, peaceful, happy mind into your body and you move with awareness, what you're doing is you're giving the benefit of sensing what's happening as you're moving, so that as you're reaching your threshold, like we talked about before, as you're reaching the boundary of how far you can move before you start encountering resistance in your connective tissue, which is your fascia, or you start encountering the resistance in your protective neuromuscular reflexes, which I've talked about elsewhere. When you bring mindfulness and awareness into movement, you're sensing when you're starting to get into the danger zone. And you're learning how to move in a way of ease. You're learning how to move in the freedom of your movement. So you're not coming up against the barriers that are created by your body's patterns of tightness or reactivity, whether it be in the connective tissue or fascia, or in the reflexes that are protective reflexes. Let me unpack that just a little bit, right? Because, let's say you've had surgery and you had a bunch of inflammation or infection or immobility, you were in bed for a while. The tissues of your body that are meant to slip and slide past each other. We're talking connective tissue that invests and wraps around your muscles, your bone, your organs. When you don't move that stuff, it gets sticky and it gets stuck together. And we call that fascial cross-linking. I could show you scientific papers that demonstrate that it happens. If you're prolonged immobility, if you're having chronic inflammation or lymphedema or any of these chronic things that go on after a surgery or an injury, the tissue just doesn't move as well. And if you have a sensitized pain system and you just start slamming that tissue to move it, whether it's stretching or moving or someone doing vigorous massage, and you've got a hypersensitive pain system because of fibromyalgia, you can trigger a pain flare. The second kind of restriction is the reflexes that are protective reflexes. You put your hand on a hot stove, boom, you pull it back immediately without even thinking about it, because you've got protective reflexes in your spine. If you had an injury, a surgery, if you have a strained neck, if you had a broken bone, if you had an area that was very painful, if you have nerve pain, you've got a hot stove all the time. And it's sending a barrage of noxious negative input into your spinal cord and brain and activating reflexes that are saying, no, don't move. And then you start moving against that because you got a physical therapist barking at you saying, do more reps, keep going, no, extend all the way. Whatever it is the person who doesn't get it is telling you. And that person could be you, because maybe you used to work out a lot and you're used to like pumping iron and doing stuff. And then you had your injury and you got sick and you immediately go back to what you were doing. But what you're doing is beating up against these protective reflexes and fascial scarring and restriction, and you're feeding into those sort of pain crisis things that you might be feeding into. You might have enough mental toughness and you might not be so sick that you could just push through it and you could feel horrible for a few days and just get back to it and do it and do it and do it. And if you've got enough biochemical inner resources and mind-body resources, you could do that. But the average person with fibromyalgia and chronic pain doesn't have those resources. And that's where the mindfulness in the practice comes into effect. So, for instance, what I teach, which tends to be Tai Chi and Qigong based. And I teach it that way because I did a lot of yoga, but yoga can be very much effortful, right? Like you want to get into that pose, you want to look like the person on the end of Yoga Journal wrapping your foot around your head. It can be kind of performance oriented where you're trying to accomplish something. And that is the last thing you want to do if you're trying to recover from chronic pain, fibro, fatigue. What you want to do is find the ease. You want to find what's easeful motion and build on it. You don't want to push yourself past your barrier. And so what the mindful approach is, okay, if you're going to do stretching, you very gently come up into the position where you start to feel the tension and you feel your tissue engaging and you stop and you relax. And you breathe. And if you meet your fascial tension and you just hold it there, it starts to unwind and release. If you meet your reflexes and you hold there and you breathe in and you breathe out, you relax, you're sending a signal to your spinal cord that says let go of that reflex. And you're gradually building that range of motion. So yoga that's taught that way is great. But a lot of teachers who aren't familiar with the whole low threshold thing are, again, just like they're giving you a goal that you need to get into the pose. I wouldn't call that skillful yoga teaching. I don't think that's the way the tradition meant it. I think the tradition meant it to meet yourself where you're at, with peace, with gentleness, with harmony, and gradually breathe into that. So what you're doing is you're building your capacity for freedom, for movement, for flexibility, for strength, with a place of peace and compassion on yourself. And that actually feeds into calming that whole danger response that can feed into chronic pain and chronic illness. So that's where that compassionate awareness really comes in. In the world of Tai Chi or Qigong, it's even less about hitting the boundary. You know, sometimes the warm-ups in those practices can be somewhat aggressive, but the actual movements themselves are really about softness. You know, like, I don't really have a space for it now. I could have prepared better, but it's sort of like, you know, we're just breathing and we're gently opening. And we're working within the range of motion and letting the breathing move, the motion move with the breathing. And you see, I'm not extending way to the end of my range of motion. I'm just moving with fluidity and softness. And through moving with softness and fluidity, I'm actually getting the tissues moving. Then there's the energetic aspects of it, which are, you know, hard to explain scientifically, although we're starting to understand that we do have this energy field. And the experience that practitioners of Tai Chi and Qigong report, and also yoga, that there is an energy, there's a vitality that you can sense. I see it as part of your biological energy field, and we work with that in my programs. And it's about sensing that and letting yourself feel it, because it starts to release and move things. It's kind of hard to explain, but it's part of the intelligence that integrates your whole body. We work on a principle called unity of movement. So it's not like, you know, I'm pumping iron focused on my biceps. It's more like I'm moving, right? You can't see this because of the way I'm standing, but it's like the movement's coming out of my left foot and moving into my right arm. It's your whole body. And then your whole body moving the other direction. And we have all these central pattern generators in that. You look in neurobiology textbooks, and it's all there. You know, like, I don't want to tell you the gruesome experiments they did to prove these things, but like, we're born with these patterns of movement. Like, why can a baby crawl? Why can a baby clutch his mommy and nurse? Because those things are built-in movements. And some of those initial reflexes that a baby has are what we call primitive reflexes. And as the child starts to learn to move and develop, the primitive reflexes go away. And then these new patterns come in. And a really skilled physical therapist knows how to work with those patterns, and they build it into their therapeutic strategies. Feldenkrais was a brilliant guy who studied this stuff, and he built it into his exercise and his awareness through movement practices. So those are all really good ways of like creating an integrative movement. Well-taught Pilates is like that. Pilates is coming from this brilliance of integrating the movement pattern so that you're using your body as one unit, which does a better job of helping you build strength and core strength and form and all that good stuff. All right, so hopefully that's interesting and useful. Here are the take-home lessons, summing it up. 1, you got to find your thing. You know, you got to find what works for you, because all the research in the world tells you what tends to work for most people. And you are you. You might not be the most people. You might not be like the people in the study. I could open up my computer now and show you literally a couple of dozen studies about Tai Chi and how it benefits fibromyalgia and chronic pain. Same thing for yoga. Same thing for mindfulness meditation and pain. There's a lot of research out there. But the critical thing is whether it helps you, right? So you're the one. And you're the one who needs to be the critic of what works for you. The second thing is be wary of trainers, physical therapists, yoga instructors, anybody who purports to be able to help you who hasn't worked with dozens or hundreds of people with fibromyalgia and chronic pain. Find somebody who has. Find someone who specializes in it. There's a lot of healthcare providers who they don't like working with people with chronic pain because it's complicated. They want to do simple stuff. They want to say, take someone after knee replacement surgery or, orthopedic knee surgery and let's rehab the knee. Yeah, all right, boom, 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 boom. And it feels good. They're doing an important, positive thing. They're helping people recover from injuries. But if you have a complicated chronic pain, you don't want that kind of therapist. It's not that they're bad and you're bad. It's just it's not a good match. So you find a therapist or a exercise instructor, whether it's conventional exercise or mindful exercise. You find someone who's had experience with people with chronic pain, and you let them teach you and guide you because they know how. That's number 2, is finding a good guide or teacher. Number 3 is remember that there's this issue of a threshold. And if you go over the threshold, you're going to hurt yourself. So learn your threshold and figure out how to work within your threshold or build your threshold. 4 is consider the mindful movement techniques because they tend to empower you and teach you how to meet yourself with more compassion, with more awareness, so that you can stay inside your threshold, learn to move, learn to feel the joy of movement, learn to improve your envelope so you can do more, you can feel freer, you can actually release the pain from the inside out, those patterns of holding, those abnormal reflexes, those restricted fascial patterns. The mindful exercise in my book for people with chronic pain and fibro is really the way to go. If I had to say, what's the main prescription? That's what it is. Okay, so that's it. So you're the one. Find a good guide, find a good teacher. Remember you've got a threshold and stay within it and build it slowly. And then focus on mindful therapies, exercises. And I hope this is good for you. If you have questions, comments, let me know. Send me a PM. And I'm here to be of service. Movement Towards Health, we're open for another day. It's a online training school for healing, for teaching you body-mind and mind-body therapies to help you come to a higher level of function, better movement, less pain, more energy, better mood. And if you're interested, check it out, www.mthtribe.com. Look in the comments for that link. Thanks a lot for watching. Please let people know about this post if you found it interesting. All the best.